Hi, welcome to Everything and Anything. Today we'll be talking about slip disc. First, I'll clarify some misconceptions to what exactly slip disc is, and then I'll define it. Afterwards, I'll talk about some symptoms and then some advices. Right, let's go. Right, now we'll clear some misconceptions. Firstly, a lot of people think that the spine is the same as the spinal cord. In fact, they think that the spine is a short form of spinal cord, which is wrong. The spinal cord is in fact a bundle of nerve that travels down from the brainstem all the way to the cauda equina, whereas the spine is a column of bone, as you see here, scientifically known as the vertebral column. Each individual vertebral column, each individual segment has their own code name. From the neck, we have the cervical, to the upper body, the thoracic, and then we have the lower body, we have the lumbar, and then to the lower end and below that we have the sacrum segment. Each individual segment has a code name such as C1, C2, T1 to T12, etc. Now, misconception number 2. A lot of people tend to think that slip disc, because of this phrasing slip, they think that it is the individual segment, for instance L5, that bone segment that has slipped out of position. But that is again wrong. What we are interested in is this empty space that we see here, but in fact it is not empty, of course. It is this intervertebral space that we see here that we're interested in. This space is known as the disc, and I'll show you later what exactly constitutes the disc. Alright, let's move on then. Now we'll move on to slip disc proper. This is a diagram depicting an individual segment of the vertebral column. Now what we're interested in is these two, the nucleus pulposus and the annulus fibrosus. The annulus fibrosus is a tough membrane encapsulating the fluid known as nucleus pulposus. Together, they are known as the disc that we are interested in. Now, there are certain groups of people who are prone to having disc issues. These people are athletes, weightlifters, workers of certain industries that needs them to carry heavy load. For instance, construction workers or that of military servicemen. As you can see, the common thing among them is heavy load. They need to bear heavy load. And when you carry heavy load that's beyond your body capability and you have not trained for them, what you tend to do is you tend to use your back as a fulcrum to lift the load. But when that happens, because your stabilizing muscles are not strong enough, your core, your back, those are not strong enough, they may give way and the load will rest excessively onto the annulus fibrosus. When this happens, you compress the annulus fibrosus to extent that it cannot revert back even when the load is removed and the vertebral column goes back. Now, this has serious issues if it happens repeatedly. The annulus fibrosus may bulge in a way that it compresses on the nerves, or the worst case possible, the annulus fibrosus just breaks. And this is what we know as a herniated disc, when the liquid inside the nucleus pulposus flows out. Now, before we move on to some symptoms and whatsoever, I'll show you an MRI scan that illustrates the disc problem that we're talking about. This is a sagittal MRI scan of a prolapsed L5-S1 disc. Now, as for the cauda equina, it just means that the horsetail-like nerve roots are coming out of the spinal cord at the end. Now, as I said just now, the bone segments have individual names, right? L5, S1, L4, etc. Therefore, the disc, we give it is in between, so we call it the L5-S1 disc, right? And as you can see, it is pressing onto the nerve. It has leaked out of its space right here. You can see it. Now, interestingly, or rather not very interesting, is the fact that 95% of all disc prolapse here, the terminology just means slip disc, a full slip disc, meaning the disc has herniated. It's not just a bulging disc, it's a herniated disc, a full prolapse. Happen right above or below the L5 vertebra. That means lower back. It could be the L5 S1 disc as well the L4 L5 disc. If you think about it, it is quite intuitive, right? When you want to carry heavy load, you use your lower back as a fulcrum to lift it up. And that is why these two discs are subjected to the most stress in the real world. Now we'll move on to the symptoms in general. You feel pain. You may feel paresthesia, which is also known as numb and tingling feelings. You will also experience motor weakness. And all these are not only confined to the area of the spine. You may also feel them in the corresponding areas throughout your body. For instance, in your L5S1 slip disc, you may experience pain in your lower limbs, your buttocks, your thigh, motor weakness, your ankles, numbness, foot of your sole. Now, if pain prolongs for more than a month, I strongly urge you stop what you're doing, go to the doctor, request for MRI scan. Regardless of the result, you should wait until all pain has gone away before resuming your daily activity. Now, in the event or the unfortunate event that you have slip disc or some form of that, disc bulge, or full prolapse, regardless, if you find yourself in a situation like this, be sure to discuss with your doctor and follow closely to his or her instruction. Do not overexert yourself anymore. Discuss the possibilities of physiotherapy. Usually the doctor will tell you to just rest and you may get better. But in the event that you do not, because a fully prolapsed disc, a fully herniated disc, there's no way to go back. So you may feel pain for the rest of your life. If this pain is causing you a drop in the quality of living, then discuss with your doctor the possibility of having a surgery. Now, I must warn you that surgery do not cure. Surgery merely alleviates some pain, and there are risks associated with it. Now, for surgery, we have a discectomy. Usually, the surgeon will remove the bulging areas of the disc or whatnot that's pressing against the nerves, and through this way, you may feel better. But the thing is, the disc may still prolapse again, so a surgery is no cure. There are other forms of surgery as well. We have laminotomy, artificial disc, we have spinal fusion. You can read it out on your own. Each have their own cons and pros. Now, I must warn you here, surgery should be and will be the last choice that you make. You should not be the first thing that you jump to, because all surgery carries risks, and risk associated with a spine surgery is extremely huge. Any complications in the surgery, if in the unlikely event that there's a damaged nerve because of the surgery, you may end up worse than before. And in some cases, you may even have paralysis for life. So this should be your last choice, your no choice choice, the choice. So yeah, that's all about slip disc. I hope you learned something, and a sincere advice to you: if you feel pain, don't tough it out. Seek medical help. That's all for today. See you in the next one.